Hi, this presentation is going to go over a few patterns that we find in the United States on the topic of death and mortality. Begin by looking at the leading causes of death in the United States, and as you can see, the top of that is heart disease. Some of these are perhaps less intuitive or familiar to people. Malignant neoplasms has to do with cancerous tumors, primarily in pulmonary disease, chronic lower respiratory diseases. Those include such things as asthma and emphysema. We have cerebrovascular diseases, which is a category that includes aneurysms and strokes. We have unintentional accidents. Of course, as we go down these, we can maybe make a mental note of prevention. Which of these has the greatest potential for prevention? We'll come back to that. Alzheimer's disease comes after that, followed by diabetes, kidney problems, flu and pneumonia. Some of these are more age-specific, such as the elderly are more vulnerable to flu and pneumonia. Number 10 is intentional self-harm, which includes suicide, which is, of course, something people hope to prevent, and so on. So you can kind of study this slide, hit pause if you need to. These are the major causes of death in the United States. If we look at death rates per 100,000 for specific groups, we can see some of these top causes of death compared for the age-specific differences and also sex-specific differences. We can start by observing some overall sex-specific differences. For example, if we look at heart disease, we see that males suffer at a greater rate. For neoplasm, it's the same story. For pulmonary disorders, actually females have a higher rate. For cerebrovascular, we see that males come in lower than females by a pretty substantial margin. But in terms of accidents, we see that males are more prone to accidents than females. Perhaps that's occupationally related. And in terms of Alzheimer's, we see that males at 16 come in much lower than females at 37. So some pretty big sex-specific differences going on. Next, we can look at some of the age patterns. Something we'll see whether we're talking about males or females is that the rate of deaths due to heart disease does increase substantially with age. For males, it jumps dramatically from the 30s to the 50s, a matter of tenfold. And then it doubles again for each of these jumps to the early 60s to the early 70s. For females, it does increase with age, but not as dramatically. And the rates are just not as high. For neoplasm, we see that there's a similar pattern. Males, a much higher prevalence at older ages, but similar age structure pattern for males and females, just a higher prevalence for males. Accidents are perhaps the exception as we look at this tendency for age to be associated with prevalence of death. For males, it's actually fairly uniform across age groups. You can see the rates are in the 50s, whether we're talking about 20-year-olds, 30-year-olds, 50-year-olds, 60-year-olds, or 70-year-olds. But for females, if we look at the accidents pattern, we see a different type of thing where there is more of an age basis. And the females are much more likely to die from an accident in their 70s, for instance. Alzheimer's, we don't have as much data for that one, so it's hard to ascertain a pattern, but more information is going to be revealed on that as we go. Incidence rates for cancer. This is going to be a comparison across time. Looking at different ethnic groups, we can see European American males have had an incident rate in the 500s going across time, whereas African American males in the 600s, so a higher rate of cancer, although that's diminishing, which is a positive sign for African American males. For European American females, you see it's in the 400s, whereas for African American females, it's also in the 400s, but actually at a lower rate. And you can read some of this table on your own, looking at the differences for lung and prostate. You might want to pause the slide at this point. Another major cause of death, as we mentioned, is suicide. Was ranked 10th as a leading cause of death in the United States. Second cause of death, however, for Native Americans and associated with suicide are often different substances like alcohol, antidepressants, and opiates. And also another kind of interesting paradox is that females are more likely to attempt suicide, but males are 4 times more likely to succeed. The primary difference there is that males tend to use guns, which are much more effective at death and completing suicide than other methods that females tend to prefer, such as poisoning or hanging. If we look at suicide rates by age, perhaps you're unaware of there is an age pattern here also, and people are much more likely to commit suicide at older ages, particularly over the age of 85. Whether we're talking 2000, 2005, or 2010, it's actually gone up for the over 85 age group. It has also gone up for the over 75 age group. There's a slight uptick in the upper 60s, early 70s, but those are the primary risk age categories for suicide. The rates are lower. Of course, no suicide is wanted. The ideal would be zeros on this table across all age categories. But relative to young children, about whom we tend to react more viscerally, perhaps, because people have the life ahead of them and so forth, the rates are much lower, just from an objective standpoint. Elderly suicide is a major problem and perhaps receives less attention. And that's going to wrap up our discussion of patterns in the United States on the topic of death and mortality. Thanks for watching.